All right, everyone. Welcome to tonight's webinar from Wu Yu, What Aesthetic Procedures and Medications Work Best in a Dry Eye Clinic with Dr. Rolando Toyos. Thank you to everyone for being here tonight. I'm your host, Dr. Elise Creamer. So I will introduce our awesome speaker. Dr. Rolando Toyos, MD, received his bachelor's and master's degrees from the University of California, Berkeley, and Stanford University, where he was a straight A student. Before beginning medical school, Dr. Toyos worked as a high school teacher and basketball coach. He won the National Teaching Award from Columbia University for his science curriculum development and his work with at-risk children. He then received his medical degree at the University of Illinois, where he was class president, graduating with James Scholar Academic Honors, and received a Community Service Award for helping Chicago City Public Schools develop a pre-med program for students interested in medicine. He completed his internship in the internal medicine at Illinois Masonic Hospital in Chicago, and he completed his ophthalmology residency at Northwestern University and Chicago Children's Hospital. Dr. Toyos spent 1 year performing LASIK at the Eye Institute in Beverly Hills. So without further ado, I will allow our speaker to give his presentation. Looking forward to learning from him, as I'm sure you are as well. And I'll be on later for questions and also for the end of the presentation.
Here are my financial disclosures. I'll be hitting on some of these companies and their products today. So the fastest growing markets in medicine are dry eye and aesthetics, and I think they do belong together. I opened Toyos Clinic back in '98, and I opened it with a very new concept at the time, and that was combining ophthalmology, optometry, eye care, medical and surgical with aesthetics. I had a building that had 3 pods. In one pod I had LASIK. In another pod I had medical and surgical, ophthalmology and optometry. And then in the third pod I had aesthetics. Our tagline was see better, look better. I think people thought I was a little bit crazy doing this kind of business model, but actually it worked very, very well. And we became one of the fastest growing companies. And lucky for me is one of the pieces of technology that I bought was intense pulse light. And very early on, I saw that intense pulse light could not only help my patients look better, but it improved their dry eye. So made that discovery early on in the opening of the clinic, wrote the first case report using IPL to help a patient with meibomian gland dysfunction and dry eye. I got a grant from Ascaris to look at this and see if it could actually, if IPL, this light technology that was a photofacial and that was helping rosacea patients get rid of redness, could be used for dry eye. So how basically it all came down is I saw patients who had rosacea. I would send them over to the aesthetics clinic. There I would do some IPL, close off those telangiectasias. They'd come back to the eye clinic. I say, well, how did that go? And they said, well, not only is the IPL making my face look better, but I feel like it's helping my dry eyes. So years of trying to develop parameters and protocols, I figured out a way that we could use IPL in our eye clinics. But what it started to do, it started to change my definition of dry eye. So what we're taught in school is immediately look at the eyes, and back in my day, we were taught that this was a water problem, that we just weren't making enough tears. We weren't talking about inflammation or making the right type of tear. So once I saw that IPL and the other treatments that I was providing in the aesthetics clinic was helping my dry eye patients, it changed my definition. So my definition of dry eye, it's a skin gland condition that affects the glands that make our natural tear, so that we're making more of an inflammatory tear. That inflamed tear actually will break down the tissues, the ocular tissues. It will break down the corneal nerves, and that inflammation will cause pain, and then it's basically a downward spiral from there. So that once you have that as your definition, you start also thinking of, well, what things can help my skin, and then you start thinking about systemic inflammatory diseases and how you can help systemic inflammatory diseases. But if you look, a lot of skin problems also are related with dry eye. So 80% of rosacea patients have dry eye. If you have acne, you have a greater percentage of meibomian gland dysfunction and dry eye. As you age, aging of the skin causes dysfunction in the glands, in the meibomian glands, and that causes dry eye. So very simply, when you're looking at these aesthetics clinics, anything that you could do to improve the skin will improve the glands, make a better tear, and you'll improve the eyes. So what is IPL? So here's the basics of IPL. It's not a laser, it's basically a gas flash lamp. The gas that we use is a xenon gas, and if you remember back to your chemistry days, that xenon gas is one of the stable gases all the way to the right of the periodic table. So when you put the xenon gas in a bulb and put electricity through it, it becomes unstable for a very short time, but its natural state is to become stable. And once it gets back into stability, it releases a broad wavelength of light, anywhere from 400 nanometers all the way up to 1,000 nanometers. What I learned is doing this and doing research is that the wavelengths of light that we want in terms of dry eye and meibomian gland dysfunction is the 600 nanometer, that red light. So it turns out that red light actually stimulates those glands, those meibomian glands, to work better. It can actually even stimulate the lacrimal gland. So red light is very important. The problem that I had early on is that with the intensity of an IPL, can be very difficult on the thinnest skin of your whole body, which is the lids. So it can't take all of that energy all at once. What research also found out is that we saw that the closer you get to the lid margin, the greater efficacy you got with IPL. So we're kind of in a little bit of a conundrum there. It's like, how do we get all this energy to the thin skin without causing any damage to that thin skin? And we can't give all the energy at once. So the modifications that I did to IPL is making more pulses so that we can divide up that energy, putting a little cooling plate so we're not burning epidermis every time we're generating heat from the IPL system, being able to put filters to block out the wavelengths of light that we don't want. So since we want the 600 nanometer, we block out all the wavelengths of light lower than 600 nanometers with a filter. So the red light's important because one of the mechanisms of action of why this works is red light is absorbed by oxyhemoglobin in these telangiectasias. When it's absorbed by the oxyhemoglobin, it coagulates that telangiectasia. So that's why in rosacea patients, we close those blood vessels. Well, it turns out that patients with dry eye, rosacea, acne, all these different things, their skin is producing inflammatory mediators, and also that's causing those glands to produce a tear with inflammatory mediators. So one study that I did with a group out in China was to show that IPL actually decreases the specific inflammatory mediators of dry eye, which is interleukin 17 and interleukin 6. And IPL also decreases the amount of inflammatory mediators that are made by the skin. Another advantage of IPL is that it's great at killing bacteria and other microorganisms like Demodex. As you know, the problem with Demodex is that they don't really show themselves. They bury themselves in hair follicles and pores, but any exposure to that light can kill that Demodex. Actually, IPL machines are used now to disinfect hospitals and operating rooms. So there's a big Xenex IPL robot that you wheel into a room, close the door, and it flashes light and kills all microorganisms. Now, what we're trying to do with a warm compress is get heat from externally and get it internally into the dermis. The great thing about IPL is it bypasses, that's light, bypasses the epidermis and goes straight into the dermis. And it generates some heat there. It generates enough heat to actually melt these secretions. So another mechanism of action is the ability to do an IPL and do an expression. If you learn anything from my talk today, please, with every IPL, you should be expressing. This is what I did and what we did in the FDA study. It's what 90-something% of the studies out there show, is that IPL with expression is the most efficacious way of doing IPL. What's the number one? And then this is actually just showing, this is toothpaste-like secretion, and then as you go through the treatment protocol, one of the good things about doing expression is you can start seeing if you're improving the secretion. So they go from like a toothpaste-like secretion, which is kind of hard and thick, to a little bit softer secretion, and then turn a little bit more yellow as they're getting better, and softer, so more like butter, till finally it's like an olive oil like secretion. So number one reason why IPL works is photobiomodulation. That these wavelengths of light actually stimulate the mitochondria in the cells of the meibomian gland to work better. And that's important because we need photobiomodulation to get meibomian glands that are either dormant, not seen on meibography, give them some stimulation to bring these glands back. So that's why photobiomodulation is important. And we see photobiomodulation in all areas of medicine now. It's being used in the retina to help patients with age-related macular degeneration. Photobiomodulation has been used in aesthetics for ages, using these red panels to stimulate the epidermis, the fibroblasts in the epidermis to make collagen and elastin. These wavelengths of light are being used in orthopedics to help tendons and ligaments and muscles heal quicker. And then we're using IPL and low-level light treatment to stimulate the meibomian glands to look better. Once you start doing IPL for dry eye, you're going to start to see that not only does it help dry eye, but your patient's skin is going to get better. And it actually gets you into the world of aesthetics. So it's a great way to transition your practice into doing more aesthetics by bringing in IPL for dry eye, because naturally when you're treating these dry eye patients, if they have rosacea or acne or aging skin, their skin is going to look better, and then they're going to start asking you if you could do these photofacial treatments for other things. So what other things can you use IPL for? Let me get this volume down. What other things can you use IPL for? So photofacial. So that was one of the first things that IPL was used for, is actually giving these wavelengths of light to stimulate fibroblasts to make collagen elastin. So you can do it for photofacial. It's these red lights in IPL are good for taking melanin out of the melanocytes, so it can take away dark spots. It can help patients with melasma, so doing IPL can get rid of brown spots. First use for IPL was rosacea, to close off those telangiectasia. So if you have rosacea patients, you can use your IPL system to help their rosacea. And acne. So this is a great treatment for acne. This is actually this patient on the left. It's a patient I had in my clinic who had severe acne, rosacea, couldn't open her eyes for 3 months because her eyes were so dry and her meibomian gland dysfunction was so bad. And after just one treatment, we could calm down all that inflammation. She could open her eyes. And she's been a patient of mine for the last 14 years now, and the only thing that really controls her acne and her rosacea is IPL, and she leads a normal life now because of it. So once I started studying things like light for treatment like IPL, that brought me into low-level light treatment. So got patents on the use of low-level light treatment. That picture that you see on the left, that is the first LED that I made close to 20 years ago to experiment and see if low-level light treatment could help meibomian gland dysfunction and dry eye. And then we've just had an evolution from that over the years till finally we have the latest edition of LLT called the Q, which I use red light and infrared to as a home light treatment to stimulate the meibomian glands to keep working after patients have had IPL. So that's had a version of the Q, whether it's red, blue, for over 10 years, and it's a great home light treatment. The one thing that if you're seeing these panels and masks and things like that, nothing works better than direct light to the skin so that light can penetrate down to the meibomian glands. The way I tell people to think about it is if you hold IPL an inch away from the skin, it's not going to be as effective as putting it on the skin. So you're going to get better penetration putting this low-level light on the skin so it can get deeper into the dermis and deeper to get to the meibomian gland so it could work better. So things that I've learned in aesthetics and things that you should keep in mind if you're getting into the aesthetics game is it's all about stimulating fibroblasts to make collagen and elastin. After the age of 28, our skin stops making, the fibroblasts stop making collagen and elastin, and that's why we start to get sagging of the skin. So if you can stimulate these fibroblasts to keep working like they did when you were younger, your skin will stay young, more elastic, and will sag less, and you'll see less of the effects of aging. So your whole goal is to stimulate fibroblasts. So that's what you're doing: IPL, RF, microneedling, RF, CO2, LED. That's what the goal is, to stimulate those fibroblasts. When you're using skincare products like vitamin C, grapeseed extract, alpha hydroxys, I've gotten away from using retinoids because I find that retinoids affect the meibomian glands in a negative way. So I try to get patients to use these other things other than retinoids. The new way of thinking is less nip tuck and pulling and stuff, and more just stimulating the skin. Of course, you're still going to have to do some surgical procedures like a bleph once this thin skin of the upper lid pushes on the eye, but you can push that off with CO2 laser to that area, or RF to that area, or RF microneedling to that area, so that you can push off a surgery as far down the road as possible. Just know the more dramatic results that you get, the more chances of an adverse event. So I tell people with IPL, the more energy that you get, the more adverse events you're going to get. So what we're trying to do is use the lowest amount of energy to actually stimulate the meibomian glands to work better. Once you start getting into higher energies, it's not always the higher the energy, the better. You get into adverse events, and their adverse events are happening in IPL because people are using way too much energy or the wrong energy. One of the things that another take-home message is basically the darker the skin, the less energy you want to give. The reason being is that the pigment in the skin is going to absorb some of this energy. So there's ways to play with thermal relaxation time and other things so that you can do darker skin, but that takes an advanced level of training. And one of the things I'm going to tell you about later on is that we do hold classes in our clinic, and we do conferences in our clinic where we can show you kind of advanced ways of doing these aesthetics procedures. Then the advantage that you have over other people doing aesthetics is that you're going to take into account the health of a patient's eyes. So yes, you could do filler, but know that now there's a problem with filler, that if you try to do filler around the lids and around the cheeks, the lymphatics there aren't very good. So you could have a problem in that area where the filler just stays there and causes a deformation and disfiguring in that area because the lymphatics aren't so good. So you're going to be looking at things a little bit different than most people. One of the worst things to do is to wear false eyelashes. The longer your eyelash, the more evaporation you're going to get with your tears. So you have to be very careful in the things that you do, and always trying to put the patient's best interests over what cosmetically they would like. All these procedures, I find IPL and low-level light to be the top of the line in terms of most effect on improving meibomian gland dysfunction. Now, these other treatments like RF, CO2 laser, microneedling RF, those things are, they do improve the skin, and anything that you do that improves the skin will help meibomian gland dysfunction. RF actually has the ability of opening glands so that you can express. Now, a lot of people are trying to stack these procedures, like do IPL and RF on top. And what you're going to find is there's only so much heat that the dermis can handle. And if you exceed that heat, you get into adverse events, and actually you not only do not get the effect of improving meibomian gland dysfunction, but you actually get some retardation of the meibomian glands, and you take a step back in the dysfunction. So the best way to use these treatments is, IPL, do the 4-treatment protocol like the FDA study with expression. And then in between maintenance IPLs, you can do an RF with expression, or you could do a full face CO2, or you could do some microneedling. And then with the low-level light treatment, the best way to use that is as an at-home treatment. Having your patient sit in the office with panels for 30 minutes and then doing IPL doesn't really make much sense. It's an epidermal treatment. It's not a dermal treatment when you have a mask or something that's not directly on the skin. So IPL is the gold standard. Low-level light treatment is a good maintenance treatment, and all these other treatments fit into the category of an aesthetic treatment that will help the skin and marginally help meibomian gland dysfunction. A lot of these treatments, the reason why they work aesthetically is because of heat shock proteins. So when you create heat in the dermis, if it's not so much heat that it burns the skin, the fibroblasts will be stimulated to make collagen elastin. But the other thing is that the body will produce these heat shock proteins that will stabilize the DNA of cells and make cells work better. So if you provide heat when you're in the dermis, when you're doing an IPL, that stimulates heat shock proteins. When you do RF, that will stimulate heat shock proteins. But if you stack IPL with RF, then you actually generate too much heat and you don't generate heat shock proteins. So there's a right amount of heat in the dermis that will create the most heat shock proteins and help the skin the most. So what's RF? It's electromagnetic energy applied that generates heat in the dermis, and you're generating those heat shock proteins so that you can produce more collagen and elastin. Here's me doing a micro laser peel using a mixto-fractionated CO2 laser. And what's the CO2 laser doing? It's actually generating heat in the dermis, causing some residual thermal damage that the body repairs, and that's why the skin looks better. Microneedling. I think here I am doing some microneedling to my practice administrator. So RF microneedling, these needles go into the dermis, and then you're giving it some RF right into that area, generating some heat and stimulating collagen and elastin. And then finally, some things that you should be aware of once you start thinking of this as a skin gland problem. You start thinking about all the systemic problems that you want to correct so that these patients can be better. I wrote this book. This is the second dry eye book I wrote. I wrote a book over 10 years ago called Dry Eye Disease Treatment in the Year 2020, kind of thinking into the future and what was going on and what future treatments were about. And then I've spent 3 years looking at diet and other systemic medications and what is the best way of treating these patients. So one of the things that we're learning in immunology right now is that the gut is very important in terms of controlling inflammation in the body. If you have abnormal gut bacteria, what happens is that the lining of the gut with this bad bacteria becomes thinner and thinner, and the walls that kind of protect the gut bacteria from the rest of the body starts to leak out. So not only do you have leaking out of bacteria, but you have leaking out of immunological factors that send signals to the rest of the body for more immunological factors to be produced. And these immunological factors are inflammatory mediators and cytokines and immunocompromising cells that uh, will cause overall body inflammation. And when you think of it that way, uh, these T cells, if T cells are created, they're making interleukin 17 and interleukin 6, and this is affecting your skin and the glands, and then you start making an abnormal tear. So, if what I was doing in my patients, this is over 10 years ago, is I was looking at this gut inflammation, um, these things that were related, and I had my patients submitting stool samples to a company because I just wanted to see what their gut bacteria was. And what I found is in 100% of my dry eye patients, they had a very acidic gut and an overgrowth of bad bacteria. Now, one reason for that is many of these patients were put were given doxycycline to treat their dry eye, and we now know that doxycycline kills all good gut bacteria. We also know that the American diet, and now the American diet is seeping its way to other worlds, but our diet is creating problems in our gut. Our normal diet in the U.S. is creating a lot of bad gut bacteria, and you can't have good gut bacteria living in acidic gut. So when people say, well, the way that we overcome this is with probiotics. The problem with probiotics is if you take a pill of probiotics, those bacteria do not survive in an acidic gut. Now, there was one study showing that probiotics could help dry eye, but the flaw in that study is they didn't look at gut bacteria. So they didn't look at gut bacteria before the taking the pills, and they didn't look at the gut bacteria after the taking the pills. So, some of this might be placebo effect when you're taking probiotic, and these probiotics are expensive. So what I try to do in the Toyos dry eye diet is I put people on a very strict 2-month starter diet. And that starter diet has prebiotics, which are things that feed good bacteria, and probiotics, which are just good gut bacteria. And this has been studied in our clinic. If you stick to this Toyos dry eye diet for 2 months, it actually will change the gut bacteria from an acidic gut to a more normal gut with good gut bacteria. And several studies have shown is the better your gut, the less overall body inflammation that you have, the less systemic inflammatory mediators are going through. So there's a lot of things that we eliminate. And then after you do the 2-month starter diet, then you can go to what I call a 90-10 diet, kind of a blue zone, where if you look at blue zones where people in the world who live the longest and the healthiest, they don't completely restrict everything they eat. They don't just eat great things for them, but they keep the things that aren't that good for them down to about 10%, so it never becomes part of their normal diet, and that it's more like of a special occasion. I don't believe in cheat days, so I tell patients never do any kind of cheat days, but more of a 90-10, like if you go to a good restaurant and they have a good dessert, just take one bite of the dessert. If you look at the Okinawans in Japan, they follow a philosophy of Ichiarabu, which means that they eat until they're about 80% full. So they don't eat everything. And if a dessert is brought to them, they'll take a bite to taste it, but they won't eat the whole dessert. So there's ways that you can modify your lifestyle to improve your gut bacteria, but I think you have to start with a very drastic change in the diet and a very restrictive diet. So the book is available on Amazon and bookbaby.com. If you want an audio book, you can find that on BookBaby, and soon it'll be on Amazon. Systemic disease, that systemic medication that I'm using a lot. So if I'm going to be taking away doxycycline from patients, I have to give them some oral anti-inflammatory. And the oral anti-inflammatory that I found works the best is low-dose naltrexone. Now, naltrexone is a opioid receptor blocker. It's given to drug addicts to keep them from continuing to use opioids. You've probably heard naltrexone as Narcan, that type of stuff. But what was found a long time ago is that in really small doses, like 3 milligrams to 6 milligrams, that you can actually decrease all those inflammatory mediators that you're trying to decrease with doxycycline. The history of this has been around for known for a long time. Back in the AIDS epidemic, a doctor discovered that in low doses he could keep his very painful patients who were experiencing extreme pain because of AIDS. He could decrease that pain using low dose naltrexone. And then over the years, more and more studies have shown that this is to be true. I started using low-dose naltrexone after I went to an anti-aging conference and learned about it. And I've been on low-dose naltrexone for the last 13 years. I did a study comparing low-dose naltrexone with other medications and found that the low-dose naltrexone, other medications like nortriptyline, Lyrica. In this study I presented at ISOP, I looked at LDN versus Lyrica. In the Lyrica arm of the study, none of the patients had improvement in the signs and symptoms of dry eye, but in the LDN we had 50% improvement. This study has been corroborated by a study that was just published a couple of years ago, again showing that LDN in about 50% of patients improve the signs and symptoms. So instead of reaching for the doxy, which you know is going to kill good gut bacteria, I would look into doing LDN. And then finally, a systemic that you probably haven't heard of for dry eye, but we published a paper looking at corticotropin in patients with severe dry eye. So ACTH has been around for over 70 years. It's an injectable, so a patient injects this twice a week. And immediately the thought with ACTH is that you're going to stimulate some internal steroids, which will decrease inflammation. But it turns out that this corticotropin actually hits these receptors called the melanocortin receptors, and these melanocortin receptors are responsible for many of the inflammatory cascades in the body. So melanocortin receptor 2 is the one that stimulates the adrenal gland to make internal endogenous steroids, but the ACTH, the corticotropin, stimulates MCR 1, 3, 4, and 5. And these receptors are responsible for a lot of the inflammatory mediators including T cell formation. And as you know, T cells make T helper cells, and T helper cells make interleukins like interleukin 17. So we've had great success in those patients that are hard to treat and that are not responding fully to IPL and the other medications and things that we do for them, that 90 days of twice a week injection of the corticotropin will reset the immunological response in the body, decrease the overall inflammation, and get patients back into a better state and improve the signs and symptoms of their dry eye. So I know that's a lot to throw at you. I mean, some of these things that I gave you in a few minutes are a full talk in and of itself. If you have more questions, you can always text me. We do have training in our New York clinic. So we do a full dry eye clinic on Saturdays, dry eye and aesthetics. So if you ever want to do a training at our clinic on a Saturday, just call that number, the 646-630-0218, and talk to them about coming into our clinic.